flipping it over, listening on the small side just to listen for any murmurs. I like that necklace you have on. It's very cute, very cheerful. I'm going to go ahead and listen to your sides. Okay. Okay, give me another deep breath. Any difficulties in taking deep breaths?
No.
Okay, it sounds very clear. Listening to the other side, just give me another couple of really nice deep breaths. Okay. Excellent. Oops. Okay, everything sounds normal with your lungs and your heart. Okay, I'm going to go ahead and grab your blood pressure. Your shirt's thin enough. I don't think we have to move it. Okay. Make sure your legs are uncrossed. Actually, I'm going to just lift your shirt just a little bit. Perfect. Okay. That's 120/84, so that's definitely within the normal range. I'm going to slide this off. Any history of high blood pressure in your family? Okay. Go ahead and give me your index finger so I can look at your oxygenation. Okay. Your oxygenation is great. It's 99% of room air. Heartbeat is 88 beats per minute, and that's normal. Can we take your temperature now? .7, perfect. All right. So now that we have your vitals, I'm going to have you just get comfortable, lay down, and I'm going to just palpate the feet. Go ahead and look at it under a light and see if there's anything I can find. Okay, so okay. I'm sanitizing my gloves. Okay. I'm just going to gently peel off your socks. They look very warm and cozy. Okay. Let's take this one off too. Okay. I'm going to just do an initial inspection here. Okay. Looking with a pen light. Also just doing a visual examination of the feet with the naked eye. I'm just looking for anything topical on the skin, like a wart or fungus, which I don't see. I do see that the skin is very dry, but that is common. I do see a slight abrasion right here. This is on that left side that you mentioned. Okay, so what I'm going to do is some gentle pressing, and I want you to let me know if you feel pain or any kind of numbness. Okay, we're going to focus on different areas of the feet, okay? Okay. Pain here?
Yes.
Okay, what kind of pain is that?
More like sharp and shooting.
Okay. What about here on the toes?
A little bit.
A little bit of pain?
Yes.
Is it the same as the pain here on the pads of your feet?
Yes.
Okay. Drawing my fingers down to the center. Any pain?
No.
Okay. And what about here on the heels? Any pain?
Yes.
Okay. Is it the same kind of shooting pain?
It's more of a dull pain.
Okay. So what I'm going to do is just take a couple of samples of the slight debris that I see in between the toes. Okay. Just to get a good idea of the skin. Okay. I know that it's a bit painful, but I'm still going to be palpating the feet. I'm just feeling for anything that sticks out in terms of swelling or any kind of bone misalignment. I'll be able to tell just by palpating the feet. Okay, I'm feeling a bit of swelling and pressure here on the top. Go and lift the foot gently, just so I can get a good idea of the tops of the feet. I'm not feeling any kind of protrusions of bone or misalignment of the pedal structure. Okay. I'm just testing to see if there's any stiffness in the toes. It seems to be working well. Okay. And then just moving on to the other foot. Is it the same level of pain here on the pads?
No, it's a lot less.
A lot less, okay. So definitely I'm going to be focusing on that other foot. What about here? Less or more?
Definitely less.
Okay. Going down a little bit. Pain or no pain?
Not as much, no.
Okay. Any numbness on the feet?
A little bit.
Just a little numb on this side. Okay. It's good to know. I'm going to go ahead. Take a sample here. Just of this area here. Especially this area looks looks like a healing abrasion. Doesn't look to be actively infected. Just gonna look at that with the light and see. Looks to be definitely blister. Definitely healing well, so I don't think that's the cause of your problems. I'm just gonna get right here in this spot where it was though, just to make sure that we don't have an active infection. Okay. Now your feet are very dry. I'm gonna go ahead and apply just a little bit of moisture to help with that, okay? Before we begin the sensory test. So it's gonna feel a little bit like a menthol kind of cool sensation, but it's gonna really help, I think. Okay. Just working to solidify that this moisture is seeping into the skin by activating pressure points here. Not a clinic that specializes in reflexology, but definitely knowledgeable of the points of the feet that are strained and can affect the organs. So I'm just gently hitting those and let me know if it gets too painful. I'm going to just be using a massage tool that is compatible with the lotion or the ointment that I applied, just to kind of help massage the tension that I feel. Try to go this route before prescribing over-the-counter medications. next I'm going to just do some percussions on the feet. We're going to move on after that to sensory tests. Just checking your reflexes here. Any pain here on the side?
No.
That's good. It's good that the ankles aren't affected. Okay, everything feels normal, albeit a little bit swollen. I'm going to do a few sensory tests. Okay. This is a sharp sensation, and this is dull. Do you feel the difference?
Yes.
Okay, go ahead and say sharp or dull.
Sharp.
Good.
Dull.
Good.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Dull.
Okay.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Good.
Sharp.
Good.
Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
Okay. A lot of those were incorrect, so you're definitely experiencing some significant numbness. Okay, just going to do some quick measurements of the feet to see if they are the same size or if one is more swollen than the other. This is 8 inches in the center. It's 9 inches here. So the right side is a little bit more swollen. Okay. 3 inches here. inches here. Okay. Just go from the side to the top. Somehow the side to the top. That's about 8 inches each. Okay. All right. So just have a little bit of clarifying water just to wipe off the oil before we move on. It's gonna feel cool. I just don't want to leave you with sticky feet. Okay. Definitely got some dirt and debris there. Let's use one more cloth. Okay. I'm going to go ahead and put on some different cloths because we're going to move on to just examining the legs and abdomen, okay? You can stay right where you are. You're doing great. So I know you're comfy right now. I'm going to go ahead and lower the blanket and with your permission lift your shirt so I can do some palpation. So you can go ahead and relax. I'll do it. Here we go. Okay, just want to get this so. Okay. Any abdominal pain?
No.
That's good. Just going to gently lift the shirt and lower your pants just a little bit. Okay. Normal regurgitation sounds of the stomach. A little excess noise in there. sounds healthy. Just going to be doing some palpations next, okay? Do you have any history of acid reflux or stomach issues?
Yeah.
A little bit?
Yeah.
Okay, but it's not bothering you today?
No.
Okay. I did hear a little bit of fluid buildup in the stomach, but other than that, everything seems healthy. Your organs feel very healthy, normal in size. I'm just gonna feel the pelvic lymph nodes. Okay, very good. Going to do a pressure point test on the stomach, okay? So this is one pressure point. This is two. Do you feel the difference?
Yes.
Okay, go ahead and say one or two.
1, 2, 1, 1, 1, 1, 2, 2, 2, 2, 1, 1, 1, 1, 2, 1, 2, 1, 2, 1.
Okay, very good. Just gonna go ahead and put this down. Now, raise your blanket a little bit so you're comfy. Next, we're going to go ahead and move on to just a cranial nerve exam. Go ahead and stay where you are. You're in a perfect position. Okay, so we're gonna do just a simple visual series of tests. Okay. I want you to let me know when the light enters your field of vision. Say now. Pick a point on the wall and don't look away, don't move your head, just say now.
No.
Okay.
No.
Okay.
No.
Okay.
No.
Okay. Good.
No.
Okay.
No.
Okay. Sorry about that, it's a little bright. So next we have a light that's a little less bright. I want you to go ahead and follow it with your eyeballs for me.
Okay.
Don't move your head, just follow it with your eyes. Good. Excellent. Okay. Any changes to your vision or blurry vision?
No.
Okay. Do you have a history of color blindness?
No.
No? Okay. I'm going to show you an instrument with a series of colors. This is
Red.
okay. Go ahead and tell me what color this is.
White.
What color is this?
Green.
And the color above it?
Red.
And the color above that?
White.
What's this color here?
Green.
Color here?
Orange.
And what about this strap right here?
Pink.
Good. And this one?
Green.
Good. And here?
Orange.
Excellent. Let's go down here to the stem. There are kind of two colors here.
Pink and white.
Okay, good. What about these two?
Blue and red.
Good. And what about these two?
White and green.
Good. Okay. And the strap down here.
Blue.
Okay. And this right here?
Green.
Good. Excellent. And go ahead and write that down. You're seeing colors very well. I have just a few more colors for you to do your best to differentiate for me. Okay. This color here, pink. Good. This color here, purple. Good. This color here, blue. Excellent. And what about here?
Orange.
Good. And here?
Green.
Yes. And one more right here.
Yellow.
Very good. That's for a little colored egg set for you. Okay. We're going to move on to a simple hearing test, okay? Just want to make sure that you're hearing things correctly. Close your eyes for me. You're going to feel a rustling sensation. I'm going to be making it with my gloves. Let me know if you hear it in your left or your right ear.
Left. Right. Left. Left. Right. Both. Left. 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 Right. Left.
Coming a little bit closer, I'm going to whisper some things in your ear. Repeat exactly what you hear after me. Okay. Snails.
Snails.
Kitty cats.
Kitty cats.
Josie B. ASMR.
Josie B. ASMR.
Flowers.
Flowers.
Butterflies.
Butterflies.
Boyfriends.
Boyfriends.
Girlfriends.
Girlfriends.
Chandelier.
Chandelier.
Grapes.
Grapes.
Oranges.
Oranges.
Curtains.
Curtains.
Scissors.
Scissors.
Snip, snip.
Snip, snip.
That was perfect. That was
Yay.
a perfect performance.
I aced it.
You aced it very well. I'm very not concerned. I'm unbothered by your hearing. So we're going to move on. I did change my gloves, so don't worry. I'm going to be palpating your face next.
Okay.
Okay, you can just get comfortable. Keep your eyes closed. Do you feel pressure on both sides of the face as I did that?
Yes.
Okay, did you feel it equally?
Yes.
Okay, I'm going to start from the center, go to the side. Let me know when the sensation stops on both sides.
Stop.
Good.
Stop.
Good.
Stop.
Good.
Stop. Stop. Stop.
Okay, good. You just continue to palpate, feeling the preauricular lymph nodes, and they are non-palpable. Next, I'm feeling the postauriculars behind the ears. Go ahead and tilt your head slightly this way. Good. Non-palpable. I'm going to be pulling on your ears. Let me know if I'm pulling up, down, back, or forward.
Up. Out. So sideways. Forward. Down.
Okay. Any pain or pressure when I did that?
No.
Alright, let's do some facial myotones. So go ahead and try to move your head to your left. 3, 2, 1. Good. Come back to center. Move to your right. 3, 2, 1. Move, move, move. Good. Do the same thing. This time I'm putting my finger right here on the bridge of your nose. 3, 2, 1. Push against me. Good. Nice and strong. 3, 2, 1. Push against me. Good. Now try to open your mouth. Good. Just putting pressure against the jaw. Now open your mouth all the way. Wide, wide, wide. Try to close it. Good. Okay, try to lift your eyebrows for me. Good. Now lift them all the way. Trying to lower them for me. Oh, very good. Okay. Not too concerned so far. I'm going to just be doing some percussions. Let me know if you feel pain. Okay. Not seeing any issues there with the face. Going to do a warm or cold test before moving on to the scalp, okay?
Okay.
Alright, so this is going to be a cold sensation. It'll be a cold sensation. My finger won't be warm. Say cold or warm. Keep your eyes closed.
Cold.
Good.
Warm.
Good.
Warm. Cold.
Good.
Warm. 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 Cold. 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 Warm. Cold. Cold.
Good.
Cold. 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 Cold.
Good. Excellent. Now I know you said you didn't have any kind of issues with the scalp. I'm going to go ahead and do a quick check anyway because that's what I do. Okay. I know you mentioned last time that you have sensitive hair, so I'm going to be gentle. I'm going to avoid any hair pulling. Just going to inspect the oil glands. Go ahead and turn your head this way if you can. Perfect. just inspect the part. I don't see any dryness, no scaly patches. A little bit of freckling. A couple very light sunspots, but no issues with moles or any troubling spots that I see. Okay. I'm going to do a sharp or cold test. Okay.
Okay.
This is cold. This is sharp. Okay.
Okay. Cold. Sharp. Cold.
Good.
Sharp. Cold. Sharp. Sharp. Cold. Cold. Sharp. Sharp. Cold. Sharp. Cold. Sharp. Sharp. Sharp.
Excellent. Okay. Thank you. Go ahead and lift your head, sorry. Go ahead and lower it. Okay, Casey. So that concludes our exam today. Everything looks really good. Your feet are swollen. There's probably something internally going on. But internally it's not serious. Okay? So we're going to get the test back and see if there's any kind of fungus. And if there's not, we're going to wait a week and we're going to see if it goes away. And if it doesn't, we're going to put you through some tests.
Oh.
Some tests with the big scanner. We're going to scan you.
Oh.
Scan you like a grocery store item.
Oh, wow, yeah.
Okay. And so we're going to get to the bottom of this, basically.
Okay, well, that's some good news.
Great. All right. Well, let me know if you have any questions in between then. Thank you for allowing me to do this exam, and it's been a pleasure.
Thank you.
Okay.